Today I'm going to demonstrate some really easy exercises that you can do if you have osteoarthritis, if you suffer from knee pain, if you're looking to strengthen your knees, if you may be preparing for a knee replacement surgery or even after surgery, but please do consult your healthcare professional and your physio for any individual concerns. So today's exercise snack is going to be perfect to do in bed before you even wake up. So we're all going to take a seated position and we're going to lie back carefully. So imagine you are just in your bed. You could do this morning and night as part of a daily knee snack. We're going to lift one leg up. We're going to hold for a few seconds and bring it down. Now think about using your core muscles as well, so you get the benefit of core strength as you lift it up, but really focus your mind to your knees, your leg muscles, the quadriceps, all the muscles in your leg that are supporting your knee, that are going to help strengthen the knee. I want you to do these leg raises, about 10 on each side, maybe adding in a few seconds hold and coming down nice and controlled, breathing as you go, lifting, squeezing, tightening and relaxing. Brilliant. So the next one we're going to do, you could actually just try and imagine pushing your knees down towards the ground, really squeezing those kneecaps down and then relaxing. So relax your whole body. Inhale and exhale, push the knees so you're straightening the legs. This is quite a small movement, but it's really powerful to try and get that length and that tension. So you're working around the muscles around the knee and pushing your knees down towards your bed or the ground, squeezing down. Now another version to do this is to lift one leg up into a bent knee position. And you could place a little towel under your knee on the floor or even a little cushion, just some little elevation. And then I want you to do the same. Push that straight leg knee down to the ground. Really apply that pressure. And again, squeeze and hold. You could add 5, 10, build up to 15, even 20 seconds here and release. Repeat maybe 5 or 10 on each side. That would be amazing. The next one we're going to do is we're going to have both legs bent and we're going to lift one toe off the ground. So you've got your heel and you're going to slide that heel down the bed or the floor and bring it up. Now try and keep your hips nice and level because you'll feel you've got to engage your core muscles here. So you're working your stomach as well. I'm a little bit shaky because I'm on the rug, so it's giving a bit of resistance. But on your bed sheet or on your ground, this is a good one because you're literally getting that nice range of movement in our knees. If you can, you're going to bring that heel even closer towards your glute and then lengthen. So what we often see is people's range of movement is actually affected, especially after knee surgery. So we want to try and encourage that full flexion when we're walking up and down stairs, especially doing our day-to-day activities. We want our knees to be able to get that full range of movement in our legs. Let's change sides again. I would love you to do 5 or 10 on each side. Lovely work. Down, lengthening out and coming up. Can you feel that? Really easy exercises that you can do in bed anytime. We're now going to add in a little bit of cycling. So this would be a nice one to do, you know, in the morning, energizing yourself before you even get out of bed. Really easy way to get this exercise snack done. Just cycling out if you can. Maybe doing 30 seconds, maybe even changing direction for a little challenge and relax. And then last one we're going to do is we're going to just circle out our ankles. So just rotating those ankles. In bed, you could do these seated, of course, which I demonstrate in my full Feel Good workout. There's hundreds saved on YouTube. Circling out your legs, circling out your ankles. We're working all the muscles around our knees. So as you carefully get back up, I'd love to show you just one or two more. So say you've got out of bed, when you're brushing your teeth, ideally, you've got your sink there as support. Otherwise, you would hold on to maybe a wall or a chair, but whatever you do, make sure you've got support because we want to reduce our risks of falls. I've been practicing, so imagine I've got my sink there. I'm brushing my teeth. We're going to try and balance on one leg. Balance is so important. We need to incorporate these balance snacks. That's why I say tie it on, stack it on to existing habits like brushing your teeth, because if you can balance on one leg, even for 10 seconds, that's a key indicator of your longevity. But we're also building strength in that supporting leg that's taking all your body weight. So really great for knee strengthening, especially as well as our balance, reducing our risks of falls, especially if you've had any surgery as well. We want to make sure not just as we age, but we reduce our risks of falls. You could try and hold that balance for up to a minute while you're brushing your teeth every day. That's what I try and aim for. Lovely work. And then if you want to extend your balance with support, I'm demonstrating without because I've been practicing. Another great one is just opening out your hips, the gate openers in and back in. So keeping those hips nice and still, but we're isolating the ball and socket joint in our hips, but just getting, again, nice range of movement, a little bit of balance as well to really strengthen our leg muscles. So this is a great one, as well as hip circles are a lovely one. So I'm just giving you a few variations. You could do 10 of each of these, changing directions on each leg. And then the last one I want to show you today is, of course, our heel raises. You know I love these because the soleus muscle in our calves is such a great muscle that actually helps to absorb excess blood sugar and balance your blood sugars, especially after meals. But heel raises are important for our knee strength as well, to build up the muscles around our calves, the backs of our knees. Again, you could progress and maybe add in holds, 5 or 10 seconds on your tiptoes. You could do these seated when you're watching TV at night, stacking it on to your existing habits. And then finally, if you are watching TV, the last big compound exercise that you know I always promote is the squat or the sit and stand. But I will show you the sit and stand because it's a really important one. Here, if you're not able to stand, the leg extension, again, is perfect. If you're stuck on back-to-back meetings, at work, under the table, after you've had dinner, in restaurants, holding out. Again, knee strengthening, really have that length in the leg, targeting those quadriceps, lifting the leg up. You can lift your knee up to your chest and then extend and get that flexion in the leg. This is a great one. And then maybe holding out. So that's your preparation for the sit and stand. Feet just wider than your shoulders. Knees always going out in line with your toes. Just body weight to start. We're standing up if you can, independently, squeezing the glutes. Slow it down as you come back down. Touch your chair, squeeze back up. Progress by adding weight, by adding a rucksack or a water bottle you're holding, some dumbbells. Really progress in terms of your muscle building. This is going to strengthen all the muscles in your legs. And if you're able to progress as well without the chair, you could do the body weight squat. You could do this absolutely anywhere. I do this when I'm waiting for the kettle to boil when I'm in the kitchen. Really important leg strengthening exercises. So there we have it. Lots of variety. This workout is saved for you. Please do share it with anyone that it can help. So many of us suffer from knee pain, but especially as we get older, we hear about osteoarthritis and also so many people having to go for knee replacement surgery. So really important to start building that strength from early, especially if you're having surgery, so that all the muscles around your knee are already strong. That's going to help with your recovery. But please do consult your healthcare professional. Please listen to your body and only do what feels good for you. Drop a comment, let me know if this workout helps you, and let's try and do this daily. Simple exercise snacks that you can build into your daily life. Let me know how you get on.